Well, good evening, everyone, and thank you for joining us. My name is Christine Robinson, and I am the Mayor of West Grey. This evening promises to be filled with information. It's a roundtable for COVID-19, and we have distinguished guests with us that will be providing updates, and then we will be having questions that have been questions to be answered. I first would like to introduce and welcome our guests. First off, from Grey County, Warden Paul McQueen, also MPP Bill Walker, MP Alex Ruff, and Dr. Ian Arra, our Medical Officer of Health. Thank you all for accepting my invitation for this roundtable without hesitation. I know we'll have an hour of very detailed information that our very engaged community will be able to listen to. I would first like to say that in terms of the format for this evening, we will have, if you could direct your attention to the agenda for tonight, we will have updates from each of our guests. And then the second part of our session will be to respond to questions. Now, we've asked our community to submit questions as of yesterday at 12 noon. And I can tell you that we did receive a fair number of questions. In fact, so many that we can't fit them all into this session, but I can promise you that we will have the responses to those questions, and they will be posted on our West Grey website, www.westgrey.com. So I'm very pleased to start this information session. So to begin with, I will provide an update with regard to West Grey. On March 23rd, the Municipality of West Grey declared a state of emergency. And since that time, the Emergency Control Group has met on a regular basis to ensure that we have the update information from the other orders of government, as well as from public health. Our fire chief is the principal emergency control plan operator. So he is very much in charge of the emergency plan and also provides our emergency control group with detailed information. He's been very instrumental in that EOC. Also, I would like to identify that our critical services have been operating without hesitation, and that very much is a part of our Public Works Department, who are maintaining our infrastructure and ensuring that public works services continue. Our administrative office, although it is closed, we are operating business as usual, and that is a sign of business continuity. Services must continue during a state of emergency, and this certainly is an example of that. As well, we've had a number of council meetings using the Zoom platform, and certainly the council meetings are essential in order to follow through on the business of the municipality and keeping the municipality on track. Our West Grey Chief of Police, Chief Martin, and our West Grey Police Service have been very instrumental in ensuring our public safety. Overall, we've been extremely busy, and I would like very much to extend a thank you to each and every one of our community members, our residents, our business owners, for ensuring the safety of our community and not extending the pandemic here. Wash your hands, practice social distancing, go out when it is necessary. And each of you have been contributing to that, and I thank you very much. And now I would like to turn it over to Warden Paul McQueen, who could provide an update from the county perspective. Warden McQueen, please.
Well, hello everyone, and it's my pleasure to be part of the call tonight. I appreciate West Grey in organizing this virtual update and allowing me the opportunity to talk about some of the work Grey County has been doing in response to the pandemic. Grey County began pandemic planning in January. This allowed us to act quickly when the pandemic and the provincial emergency were declared in March. All of our services have been impacted in some degree, but staff are doing everything we can to ensure our residents can continue to access the essential services we provide. Long-term care, of course, is our greatest priority. We know the elderly and those with compromised health are at the highest risk to this virus. In response, all 3 county homes, including Rockwood Terrace, are carefully following ministry directions and recommendations to our public health officials to do as much as we can to keep COVID out of our homes. Full visitor restrictions are in place with the exception for essential visits if a resident is very sick. Everyone, including staff, are screened when entering the home. Staff and residents have temperatures checked daily. Staff are limited to working in only one long-term care facility and much, much more. County staff from other departments have been trained to assist in long-term care homes if the need arises. Some staff are already redeployed to help with activities in the home, like our Colored It Connect program that allows residents to visit virtually with family and friends. We continue to support vulnerable people in our communities through Ontario Works and affordable housing. In addition, we are working to enhance supports with the Provincial Social Services Relief Fund. This funding supports community agencies who assist people experiencing homelessness or who are at risk of becoming homeless. We have approached service providers in our community, and funding will support organizations that provide meals, food delivery to people isolating, support for self-isolation, or emergency housing. Funds have also supported a reception center in Owen Sound in collaboration with the Canadian Mental Health Association, Grey Bruce Public Health, and Safe and Sound. Our paramedics are responding to calls throughout our communities. They are wearing the necessary personal protection equipment on each call. We are also part of an initiative with public health that allows Grey County paramedics to perform swab tests for COVID-19 at home for anyone who has symptoms but is unable to travel to an assessment center. We are happy to help in this way and thank Grey Bruce Health Services for the clinical training our paramedics have received. At this time, all Grey County buildings, including satellite offices, Grey Roots Museum, and Provincial Offences Court, remain closed to the public. We continue to offer a number of our services electronically as many of our staff work from home. I encourage you to visit our website, grey.ca, to learn more. Economically, Grey County has been doing what it can to help connect businesses with the supports available provincially and federally. If you visit our website, grey.ca, you will find a number of resources listed. We also have a business support helpline you can call, and our staff will help you navigate the programs available to your businesses. We have been in close contact with businesses throughout the emergency. Just last week, our business survey closed. The information collected helps us understand the impact of this pandemic on local businesses and will help us plot a course for recovery. We have many other activities on the go, but I think I will stop here so we'll have lots of time to get to questions. Thank you.
Well, thank you, Warden McQueen. That was an extremely detailed update, and we very much appreciate it. It is essential that our residents here in West Grey are informed what the county is doing, and we really appreciate the county's work throughout this pandemic. So thank you, Warden. And now on to our Member of Provincial Parliament, MPP Bill Walker. Welcome, and we're certainly looking forward to your update, and thank you very much to you and your government for all the assistance during this, this challenging time.
Thank you very much for your worship and everyone else online and everyone else listening, and to all those people, frankly, across all municipal services that are kept all the services and programs going during this time. Mayor Warden McQueen and MP Ruff and I speak every day along with Dr. Arra. We have 2 official calls, and then we speak probably more to each other than we do to anyone else in the world. So to them, thank you so much for all that you've done on behalf of us. You know, at the provincial level, we've tried to do this from day one. The health and safety of the people of Ontario has been our absolute priority. Everything we do is done in concert and consultation and cooperation with the Chief Medical Officer of Health for the province, Dr. David Williams. We've continued to do that. We want to thank everyone out there who has actually been adhering to the rules and regulations and those directives to say, stay at home, keep your social distance, only go out for essential purposes, essential businesses. You know, we knew that we had to make some tough decisions and people adhered to those. And as a result, we were able to get that curve to be bent down and actually limit the spread, particularly across communities. I'm pleased to say that I'm not even certain if today's Monday or Tuesday now, but if it was Monday, we actually started opening up to some businesses. I just got off a 3.5-hour cabinet call to talk about what that may mean in the future, and we'll try to do everything in a timely manner. Again, always balancing first and foremost health and safety along with the economic realities of today and also looking at the future. So we are all focused on ensuring that people get through this pandemic. It's a one of a kind. There is no playbook. We're doing things at a very rapid pace. It's all very fluid. You just barely get one door closed and 3 more open because people are thinking 6 steps out as soon as they start thinking about opening up the economy. What happens here? And there's lots of legislation, regulation that has to be changed to allow some of these things to happen so quickly. So I can just assure you that we are all doing our best, as you are, to make sure that we balance those 2 things, never forsaking, again, health and safety. Certainly lots of concern out there from some businesses, particularly the small mom and pops. Alex and I talk on a very regular basis about some of those programs, particularly for the self-employed. Those are being addressed continually. They're being ratcheted up, changed, and we're finding out the gaps. But I can assure you that everyone in the public service in both the federal and provincial and frankly municipal and county levels are doing their utmost to try to make sure there's as few gaps as possible, get that support where it's needed, get us through this big crisis, and then start to look forward to recovery. So I'm very hopeful. I'm actually very proud of where we are today, what we've been able to do, and that we'll continue to come out of this as long as we all stick together and make sure we put the greater good as our absolute priority. Thank you so much.
Well, thank you, MPP Bill Walker. Extremely well said. I really appreciate the coordination and the cooperation for all orders of government, and certainly including public health in that. I completely understand that our current reality is very fluid. It is what it is, and we will certainly pay attention to the changes, and we will absolutely get through this. So very appreciate your update. So now let's move on to our member of federal parliament, MP Alex Ruff. Thank you for being here, and we are anticipating your update. Please go ahead.
Yeah, Your Worship, thanks so much for inviting myself. I'll echo a lot of Minister Walker's comments about just, you know, we're privileged to be representing this area because there is a very high level of integration and cooperation and collaboration that's going on a daily basis. And I guess the other point I'd make is that, you know, today alone, Bill and I have been talking all the way up the peninsula, all the way down to the south end of the riding now, really. So unlike when we're doing it physically, it's a lot more difficult to get all over the place. Just 2 seconds. I got a 6-year-old here. Sorry about that.
No worries.
She wants ice cream. In the end, you know, it's a lot more difficult when we're driving around to get from one end of the to the riding and back. So today's that's the one, I guess, advantage we have with technology today. Obviously, there's been a number of programs that have been announced by the federal government since this crisis unfolded. I'll get into some specific questions and answers later if for specific constituents that have any questions. But I mean, obviously there's the emergency response benefit, which is the big one that impacts most individuals at the across the riding at that individual level. There's the emergency business account, which has had some challenges to it, and it still isn't perfect because, again, especially for the small and micro businesses like Bill had mentioned earlier, that they just don't qualify and don't meet the requirements or the criteria that's established. But there's some great work being done, again, locally through the Community Futures Corporation. We discussed that earlier on a call today. For, I think, Wes Gray, I believe it's Rose Austin, and she's the one responsible for you guys that, for your municipality that can help out there, and they're going to be rolling stuff out in the coming days. There's the student benefit, there's the wage subsidy, there's rent relief that is tied to the province that has a little, a little bit more complicated because obviously it's been announced at the federal level, but the funds have to roll down to the provinces. And today, I have the details, the bullet points that were announced from the federal government. Finally, a bit of support for our farmers and our agriculture sector. However, hopefully there's a lot more coming, but we'll see how that plays out. My understanding, though, that is going to require legislation to be passed, so some of that money isn't going to flow right away because it does need to go through Parliament, under the streamlined process. The only other point I'd add is the Canada Summers Jobs is something that's impacting everybody across the riding, and obviously West Grey has a number of applicants. That information should be getting made available to myself in the next 4 days. Service Canada is supposed to get us back with the final approved lists. We'll all be able to identify, contact and let everybody know who's qualified and who hasn't based on the final list that Service Canada approves. So other than that, please feel free, anybody, to reach out to my office at any time. The contact information, I'm sure, is out there. It's not hard to find if you Google, but just alex.ruff@parle.gc.ca, or the phone number is 519-371-1059. Thanks.
Well, thank you very much, MP Alex Ruff. That was a very comprehensive update, and we very much appreciate it. And I must say that our community very much appreciates your representation at the federal level. So thank you for that. And now on to Dr. Arra, our Medical Officer of Health for Grey and Bruce. Dr. Arra, first I just want to say a heartfelt thank you to you and your team at Public Health Unit. You're doing an outstanding job. I know it's a very detailed job and it's most continuous, but our community is most grateful to your leadership and your role. I wonder if now would be a really great time if you could provide an update for us, please.
Your Worship, thank you for this forum and for your comments. Much appreciated. The situation in Grey Bruce is so we have 88 cases as of today, and the relative positivity of the situation speaks for itself. We have relatively low number of cases. We have 0 death, and we have no hospitalization at this point. We had 1 case of hospitalization without ventilation. We have had only 4 outbreaks in nursing homes. 2 of them have been declared clear, and the other 2 had only 1 case in one of them and 2 cases in the other. And again, this is relatively very positive results for the area. And the success so far in flattening the curve that was done throughout the province, and I would say in very good way in our area, lends itself to 5 corners, the way I think of them. There is a healthcare system that is robust, healthcare providers who are expert in doing the heavy lifting whenever we need to identify new cases or test. And they do this very, very, very well. I can't speak highly enough of their work. The second element is public health. We have robust protocols that have been refined after SARS and further refined in the preparation for Ebola. And I can speak to them firsthand, applying them these days. And we have an excellent team. I'm very proud to be part of the team in the health unit. And again, I cannot speak highly of the team as well. The third element is political will, political commitment to health. This is a term that I used multiple times, and it was in my training. I've seen it in multiple places. I have never seen it crystallized so clear and so well more than this emergency. I thank everybody around the table, MPP Walker, MP Ruff, and Warden McQueen and Warden Mitch, who's not with us today. We meet quite frequently, and again, the amount of work that's been done in the middle of emergency would mount to probably 2 or 3 years if we were not in the middle of emergency. I've seen cutting through bureaucracy. We have an excellent bureaucracy that would ensure everything is done well and examined in the regular days. In the emergency, we need to move fast, and we need bylaws and laws to be enacted. And again, the political will, many people would not see it. It is really the dynamo of the response. And I see it locally, I see it provincially, and I've seen all type of intervention implemented in no time because of that. So thank you all. The fourth element is the community partners, whether government organizations or NGOs and other businesses that are geared towards supporting the cause, making donations, and there are plenty of them. And they have been an instrumental in this response. The final element, and probably the most important, is being all well served with public that is informed and that is concerned but not afraid. Hand washing and all the other social distancing measures would have not been successful, no matter what public health would come up with, if the public did not act nicely. The curve that we have been anticipating to have has been flattened. And again, like MPP Walker said, with every door we close, there are 3 open. And now we have the final part of my update is the going forward plan. The team in the health unit has put together a plan for reopening locally. And the 2 main elements, Your Worship, to be notified of is one, it is staged approach, similar to the province staged approach, and that's the better practice. And the second one is to be aligned, unified with the province and other health units. And these plans have been communicated to the county, and the input for the decision maker, for the local community leaders is paramount in the success of these plans. So that is my update, Your Worship, and I'm open for questions after.
Well, thank you very much. Thank you very much, Doctor. That was a very detailed update, and I know that our citizens would appreciate that. Certainly the common thread in all of our discussion is the safety and security of our residents, and that comes across absolutely clear in terms of the role that each of us are playing, and the fact that there's coordination and collaboration, I think is really important. So thank you for all of your hard work on that. We have now completed all of the updates, and we're transitioning over to the second half of our roundtable. And now we will begin with the question and answers. So our CAO, Laura Johnson, will be managing this portion of it. And in just a minute, I will transfer the mic, as it were, the virtual mic, over to our CAO. But I do want to mention to everyone that we did receive a fair number of questions. I was absolutely impressed by the number of questions that we received. So we were only able to get a certain amount on for this particular roundtable. And again, we will ensure that all of the questions are responded to, and they will be posted just within a couple of days. So I thank you all our citizens for being engaged and participating in this roundtable. You know what? I would like to start with a question, and it is for MPP Bill Walker as well as Warden McQueen. I'm going to ask a question with regard to internet. So I would very much like to impress upon you that West Grey residents and business owners, and indeed Grey County residents as a whole, require internet, plain and simple. So could you give us some idea when broadband will come to this area? Perhaps MPP Walker, you could start.
Thank you, Christine, Your Worship. Just before I answer that, if I could just say 2 things. One would be that if we don't get to your questions tonight, both Alex and I post our names on there in our emails. People can send those directly to our staff, and I want to send a huge thank you to both of our staffs. They've been working day and night basically to keep up with everything and ensuring that we are able to provide those services. So thank you to that. And you talked about us giving an update, certainly from the provincial perspective. The Premier's on virtually every day at 1 o'clock giving an update of what's happening and what changes are happening at the provincial level. So people, again, can stay informed. It is fluid. It is changing there. In respect to internet, obviously, we're utilizing technology tonight. So I think if we can, I always try to find a positive, even in a negative time. We've certainly found out what connectivity can do and how efficient we can still be with that. So there is the SWIFT program. It has been earmarked by both the provincial and federal governments as an infrastructure program. It is in phases. It's probably not going nearly as fast, particularly for those people who do not have it in a rural area, but it is staged to go across southwestern Ontario. I don't have exact dates, and one of the things we're certainly finding with COVID, the more you try to think you can give a date, the more you look like Wyerton Willie, and you're really giving a prognostication that's out there at the best of times. But it is coming, and I think what you're going to see as a result of COVID-19, people having a much deeper appreciation for how impactful this is. Most of the public service is actually, frankly, working from home, whether they're in a rural area like West Grey or they're in downtown Toronto. So that ability and that capability becomes fundamental. People have now seen the value that it can provide, and I can assure you from our cabinet that we definitely understand and value, and it is coming, and we'll continue to push wherever we can as expeditiously as we can.
Excellent. Thank you very much. And now for a Grey County perspective, Warden Paul McQueen, please.
And thank you, Christine, and everyone for that question. And just to follow up on Minister Walker's comments, certainly SWIFT has been a plan that's been in place for a number of years, and that's basically the southwestern part of the province. That's part of a consortium to move forward to try to maintain a bit of a balance in the sense of internet for everybody to be able to use. And part of that is 50 down, 10 up. And part of that process, we're just a little bit from making a lot of an announcement here from the County of Grey, and there goes my clock. Sorry about that. But there is a report coming to County Council next week with moving forward to the next step toward with regards to a bigger awarding of providers that's going or internet providers that's going to go out and provide that 50 down, 10 up. And part of what it is, Christine and everyone else, is it's that balance, that level playing field. So they'll go out and they know what they want to provide, but they'll go to all the different providers out there and say, what can you provide us? And that all goes through a process. We're just not quite there yet. And I know that the CAO of the SWIFT program itself, he's going to come and speak to us at County of Grey to County Council, but it's been a little bit delayed. And going back to what Bill was saying about COVID-19, there was 3 counties that have already gone through the process in the second phase, and then we're moving in now to the third phase. So all I can say is certainly we are moving toward that. And we all know, as Minister Walker has said, that this COVID-19 has certainly opened up our eyes to the point of the need for internet and better quality internet, and even from the point of school kids. And we see that from that part of doing their homework now online and stuff like that. So, you know what, it's just pushing us into that a little quicker, but certainly SWIFT is coming. And again, Christine, there is a report that is coming to our County Council next week that moves it through that next step.
Great, and we certainly will be anticipating that report at the county level. And COVID-19 has just amplified the need for broadband in our area in Grey County. I do want to ask MP Alex Ruff. He's indicated that he'd like to speak to this, and I'm very delighted that he does. So please go ahead, MP Ruff.
Yeah, thanks. So I don't have a lot of details other than obviously the federal government does play a piece of this as well in providing financial support, and even more so on the innovation side of the house, because there's always more than one option to do to kind of skin the cat sometimes. So this has been raised with the federal government. It was the first question I asked during the emergency sitting of the Parliament Easter weekend, was exactly about rural internet and the importance of it. So we're pushing the government, as Warden McQueen rightfully identified. COVID-19 has just exacerbated the situation. So we're going to continue to push that. I talked to Minister Baines, the Minister of Innovation. You know, there's different ideas that they're working on that would, open up to even stuff like low Earth satellites and stuff that would provide a different way of interjecting internet to our more rural areas. So I just want to say that I'm working on your behalf as well at the federal level to push this along, and so we can push either greater funding or greater support down. Thank you.
Great. Thank you one and all for your responses. At this time, I'm going to pass the virtual mic over to our CAO, Laura Johnston. She will be managing the question period. And I hope everybody has noted that the first question, as well as our subsequent questions, will be on screen. Madam CAO, would you like to take over at this point?
Yes, thank you, Madam Mayor, and good evening, everyone. The next question is for Dr. Arra. So if we could change to the next slide, please. Thank you. Good evening, Dr. Arra. Could you explain about the testing in our region and what information and findings are being reported?
Thank you, Madam CEO, for the question. The testing that is done, there are two types of testing that exist for COVID licensed in Canada. The second one is the shorter, and that's not being used fully yet for good reasons. I'll start with it, then I'll go and explain the first one that we are using. The second one is the serology testing. It was approved by Health Canada recently. The test being new and the virus being new, the reliability of the test has not been established yet. Grey Bruce has received 75 tests from the province to use it in a research capacity in line with the Southwestern region, Ontario Health. They're together, all the health units have 700 tests. And this would be useful down the road when proven reliable to basically see how much herd immunity there is in a population. And that will be coming in the weeks or months to come. And it might not change anything at this point in our management of the outbreak. So the first test that we use, and we use on a daily basis, are the swabbing, the term that we use for testing. The Ministry of Health directed public health and the hospital to put assessment centers, and within a week or two, we had 3 assessment centers in our area, a full capacity to test. And the test itself is a swab taken from the nose or from the throat to prove there is a virus shed in the person, if they have symptoms or not. The test, as a test, is a simple procedure, but the testing as a system is a really complex entity that is just very robust, and I cannot really take credit for it myself. It has been established over the years. The swabs, wherever they happen in Grey Bruce or in Ontario, if the resident was from Grey Bruce, the results will come back from the Public Health Ontario lab to the health unit. Many people ask about, do you know where the swabs or the tests are happening? And the simple answer, we know exactly where they happen when they change our management, precisely in the long-term care in the hospitals. We have these tests reported to us on a daily basis. If people traveled across the province and got tested different places, we will still receive their test in Grey Bruce, and we receive the positive and the negative. The length of time for processing of tests in the lab is a product of multiple variables in the equation, more specifically the number of swabs going to the lab at one time. However, the system has reliability in it that if we need expedited testing for a long-term care or a healthcare worker, these are the swabs that if results come back immediately, we would change our management. We're able to get the results within 24 hours. And recently, the province asked us, the Ministry of Health asked Public Health to do testing in long-term care to test all staff and residents. We have a plan started last week, and we've been testing 1 or 2 facilities per day, depending on the size of the facility. The number of tests per day in these facilities varied by between 100 to 400 a day. And that's only the long-term care. We'll complete all long-term care within 2 weeks as planned. And the lab has been returning I would say, most of the tests within 24 hours. So that's the first part of the location of testing. In the hospital, there are about 20 to 30 tests per day that happen. Assessment centers between 30 to 70 per day. Family primary care are much less, just because they refer to the assessment centers. And in aggregate setting, it's with primary care is about 20 tests per day in average. So that's I would say, comprehensive answer to different aspects of testing. And what we report in a situation report on daily basis is basically what many of the public would ask for. I realize there are different asks for different types of information. It is always a fine balance to find what's useful and what could be misleading or could be misinterpreted. And we strive to work with feedback and respond to the public's concern and requests.
Well, thank you, Dr. Arra. And now we will just have Madam CAO's mic unmuted, please. Madam CAO, please.
Thank you, Madam Mayor. And yes, thank you, Dr. Arra. Mayor Robinson, the next question is for you. So we'll change the slide, please.
Okay.
Here we go. When will the tennis and pickleball courts in Durham or the arena in Newstead be open, or the SBCA properties? West Grey needs to give some thought to opening up some of these spaces. People want to stay active and want to do more than walk down the road.
You know, I have to tell you, I've been anticipating a question like this. You know, West Grey residents are eager to get outside and to be very active and just to enjoy the beauty of our community. But right now, I do not have a definitive date where I could say exactly that we'll have our tennis courts open and our community centers and arenas open. We are following the direction and the guidelines from public health and certainly our provincial government. But I can say that once they are opened, we will be ready for it. So that's the type of response I could give to this question right now. Please just stay diligent, and when we're able to provide the information that we are able to open up those certain activity areas, we will absolutely let the community know. Thank you, Madam CAO.
Thank you, Madam Mayor. Our next question is back to Dr. Arra. Thank you. Dr. Arra, with test results taking some time to return, although you have given us a very helpful update, but still, how do people address the risk of either worrying needlessly or assuming they are negative and returning to regular habits before they have confirmation either way?
So this is something that's addressed in the protocols. Anytime somebody's tested, the direction would go immediately to them to self-isolate until the results are known. So the risk of transmission with somebody who has tested, no matter how long the test results take to be returned, is the same. It is contained. The length of time for the return of the results could be, again, as I mentioned, related to different variables. One of them, the pressure on the lab system to process a certain number of swab. The other part that many people don't realize, some of these tests come back as the results as non-conclusive. So the tests need to be repeated in the lab. We don't receive it until we get the conclusive result, positive or negative. So sometimes it takes a bit longer. However, anybody who has been tested will be asked to self-isolate, and they should not be basically returning to regular habits before they get the results. And that's something that our staff would follow up with, whether cases or contacts.
Thank you very much. Again, we're just waiting for Madam CAO's mic to be unmuted.
And thank you, Madam Mayor, and thank you, Dr. Arra. Our next question is for MP Ruff. Good evening, Minister Ruff. My wife had trouble filing for the Canadian Emergency Response Benefit and spent hours on the phone. Have you heard whether access to this is improving?
Yeah, so the short answer, it is getting a bit better, but it is still a huge frustration for many people that are trying to access the Service Canada or the Canada Emergency Response Benefit phone call. So the long answer is, if you do require, one of the things that they've put forward is a a specific request, I'll put it into the chat here for everybody that can do it. So you can do a sort of an e-request, and it will get an agent to call you back within 2 days. That being said, if you're still having issues, and we get a lot of these on almost a daily basis, please give us a contact, provide us as much information as you can to the office, reach out to my office, and I'll my staff we can interject. We have a separate line where we can try to get to some resolution forward. So bottom line, it is getting better. There's still loads of room for improvement. But again, contact me if you're still running into those frustrating situations.
Good, thank you very much. Our next question is for Warden McQueen. Good evening, Warden. The tourism sector in Grey County will be devastated with all of the restrictions on travel. Can you please tell us when cottagers and tourists can return to Grey County?
Well, we know we don't have a crystal ball to fully realize when that will be happening. We'll certainly be taking our direction from the province. And I think we have a little bit of an indication of that last Friday when there was a few announcements came out from the Premier of sort of easing that part. So certainly we'll be following the lead of the province on that type of thing. Certainly, I think we're starting to see it already where businesses are, like, for example, I think Longo's and Costco, where they're now have a new level of everybody wearing masks. You still have to keep that distancing and all that type of protocol in place. So I think you're going to see, and maybe this is a further question, maybe that Minister Walker could also maybe have an opportunity, because cottagers in our area has been quite a conversation, and I think our Grey County, there goes my clock again, Grey County versus Bruce County, there's there's a little bit of a conversation going on there, and I think the real telling tale, as Dr. Arra has said, is we've been able to keep the curve of the COVID down, and I think that just shows how strong we've been doing the right thing as individuals. And so we got to be very cautious, caution going forward in the sense of it, coming forward with the tourism. But we know the nice weather is coming, so there will be a number of protocols that will need to be put in place to allow those individuals who come to their cottage. And I guess on the other side, I know I've heard that the small businesses that have the offset to those the tourists that come to our area and the offshoot of those businesses. So there does have to be hand in hand in the sense of the proper protocol, and certainly from the guidance of the medical health Dr. Arra with regards to the medical health unit of the Bowen Sound, and his guidance that will be provided in moving forward to this new reality when it does come. I don't know if Minister Walker has any comments there or not, but
yeah, I would certainly encourage. Yeah.
Certainly happy to chime in, and more important, I think Dr. Arra can substantiate this. We've tried to operate from day one with an abundance of caution to ensure that people aren't moving anywhere they don't have to. No one out there can guarantee that they're not a carrier of this virus. So if they all come up here, even with the greatest of intention, to only go to the cottage, if they have a medical mishap and they have to go into our local hospital, they are taking that into the hospital. We saw something earlier about the conservation authorities in the parks. If someone snaps an ankle and ends up in an emergency and they are a carrier, they are taking that, and then it's going to spread through our community. We've been very fortunate in Bruce Grey Owen Sound to have very limited, frankly, community cases. Most of it, sadly, has been in the long-term care facilities. But the more people start to move, the more that virus can come in. Our concern is if you open it wide open right off the bat, we could actually have that spike go right back up. The medical officers of health are going to come out and say, we're going to have to shut down things. And it's going to be doubly challenging for people to go back inside again after we've done so well to get there. So it has to be what you said, an abundance of caution. It's going to be strategic. Those cottagers, I get it. If you're in a downtown Toronto, if you will, apartment building, and you've been cooped up for 6 weeks and you've got a farm property or a cabin or a camper, you definitely want to get to a beautiful place like Bruce Grey Owen Sound. But out of out of the care and concern for your fellow human. We're just asking, be patient with us. Let's do it in a strategic manner so that at the end of the day, we come out of it faster and we actually keep moving in a good direction to whatever the new normal may be. Dr. Arra?
Thank you. I was just waiting for the unmute. I totally echo all these points from science point of view, like we discussed many times. Opening, releasing restrictions at the end of pandemic or in the recovery phase is best done through staged approach. So we would select the different activities that exist in our community and different businesses, and we list them. The practical way the process starts is with public health to ignite the decision to open certain restrictions. The decision itself is done through multiple stakeholders around the table. That initial ignition takes place in a shape of listing all activities and looking at each activity from different factors. One, how many people are going to be there, the space available, the risk of transmission. So we would evaluate these activities and businesses as high risk of transmission, moderate, and low. And usually when we open each stage, we start with the lowest risk first. So trails or courts or golf courses where there is a huge amount of space with limited number of people. Then we would wait 2 weeks to 4 weeks and evaluate, is there a spike in the cases? And if there isn't, we proceed to the next stage. And if there is a doubt about it, we extend the current stage. And if there is a spike in cases, we retreat or we roll back the changes. And again, a principle to the approach is to have unified approach with the rest of the province. We might have lower cases. However, if we open our area or reopen activities before the rest of the province or the neighboring health unit, we're turning our area to a magnet where people would come over to shop or to vacation. And that's not a better situation neither to the locals nor to the cottagers. We have really good compliance from all around, from the residents and the visitors who stayed put wherever they are. And we continue to try to open these restrictions as soon as we can. However, we need to be guided by the numbers and the better practice.
Well, thank you very much. And that certainly is the essence of a roundtable. So that was a lot of information generated from the one question. So really appreciate that detail. Madam CAL, please.
Thank you, Madam Mayor. Our next question is for MPP Walker. Could we have the next slide, please? Minister Walker, what is the province doing to protect our most vulnerable during the pandemic?
Great. So, I think there's a lot of things. Am I on? Yes?
Yes.
Yes. I'm not lit up, so I didn't know whether I was on or not yet. So there are a lot of things out there. I won't go into it, every detail of every program, but at the highest level, we have tried to make sure we put supports out there to the most vulnerable first so that they had them. We did things through Minister Smith and Community and Social Service to ensure people could go into some of the programs without actually triggering a clawback or losing their benefits, most importantly. We've done things like that. There was $200 million allotted to Community and Social Services, which included not-for-profits and charities. And I think in Grey County alone, that was about $1.9 to $2 million. Some of that was funneled directly to O'Share and the food bank out of Owen Sound and some of the other food banks. So we're trying to do things across all of our ministries, wherever we can do that, wherever we can limit the impact to people. We're looking right now, particularly for seniors, we had to originally put a limit on your prescriptions. So you went from a 90-day to a 30-day so that people wouldn't hoard and go out and order thinking that this was going to be the last time they got to order. We're now through that, and I can tell you at the cabinet table, we've had discussion on how we go back because we know that added 3 dispensing fees instead of 1 originally, but we had to do it to keep those limits so we didn't go short and people went without their medications. So in all cases, we're trying to do whatever we can, obviously with a filter of the more vulnerable in our society. We're actually reaching out to various groups. And I want to give a bit of a plug here to a great company in our own backyard, Bruce Power, who have given $300 million, I believe, to our food banks, to those less fortunate, and a number of other companies, too numerous to name, have all stepped up and helped with those types of causes. So we are doing that wherever we can in concert, but most of it, both at the federal, provincial, and I believe as well at your municipal levels, are doing things wherever you can to defer payments. In our case, my hydro energy file as minister, one of the first actions we took as a government was to actually take out the time of use and go to the absolute lowest fee. So that not only helped the most vulnerable, it helped everyone, because we knew people were going to be forced to stay at home. Their energy bills were going to go up. So we wanted to spread that across as many people and lessen the pain and the challenge of COVID as much as we could.
Thank you, Minister. Madam Mayor, if I may, Dr. Arra would like to also comment on this question. So perhaps we could unmute his mic.
Absolutely. Dr. Arra.
Thank you, Your Worship. Before taking a step at this question, I would like to mention something that many people would know, some people might not know. As the Medical Officer of Health, my position is apartisan. It is apartisan, and it is 100% in my practice. And I can answer this question with this simple answer. There is nothing that I know that the province hasn't done. I think the question should go the other way. What is the province not doing? And that will be an easier answer. Nothing. I can witness it firsthand. Everything that a public health practitioner would need is happening in a speed that, again, it's a textbook, and I feel very privileged being part of this system. Thank you.
Thank you for those comments. Madam CAO, please.
Thank you indeed. In fact, our next question is for you, Dr. Arra, so perhaps we could change the slide. Thank you. Dr. Arra, there is a lot of confusion about asymptomatic. If I have not had symptoms for 2 weeks, does that mean I can visit my family?
The simple answer, the short answer is no. The data from Mapleview, a local facility long-term care that we tested everybody, we found 22 cases, 12 of them had no symptoms. So the fact a person has no symptoms is not an indication there is no virus. Right now, I have no symptoms. I presume people around the table have no symptoms. It is safe to assume that any one of us or all of us might be shedding the virus right now. To visit a family, it would require a person to be self-isolating completely for 14 days. And there are a couple of incidents where family reunion needs to happen, and always the advice is to stay home for 14 days, then move in with your kids or with your family. Having a test of a person without symptoms is not going to change the management at all. I could be tested today negative, and I would test tomorrow positive. I could be tested 14 days in a row negative, and the final day I would be testing positive. And again, that goes to the big city media outlets have led the public to believe that testing everybody is a good idea. It's a silver bullet, and it's not. And again, there's a lot of evidence that that would not change the management in outbreaks. That actually might cause some harm where the predictive value of the test, the reliability of the test itself is threatened. And one example is the Sepoy Manor retirement home that was declared as an outbreak based on one test of a person who is asymptomatic. And the first step in the management is to isolate everybody in the nursing home and the retirement home, because we need to deal with it as an outbreak. The second step would be, and was, to test the person 3 more times, including the first sample that was taken as positive, and all these 3 samples came back negative. So again, there is potential harm from testing everybody. There is a good reason to test everybody in long-term care, and it is to reduce anxiety in the public, to reassure the public who was led to believe that testing everybody is a silver bullet, and the ministry is not providing this test. So the intervention is to reduce anxiety in the public, and it is a better practice. Testing a person asymptomatic to go back to visit their family is not the best way. But again, you need to look at every situation. I'll go back to the question itself. If there is potential harm of mental illness, or if there is hardship, can the family have a visit with some social distancing to mitigate for that loneliness or the need for family support? There are different ways to do it, and I would encourage people to go to our website. We had a large amount of documents produced recently addresses the different needs and questions from the public, including this one. And I just put on the chat the link to the website. It has many subjects, whether COVID in maternity or breastfeeding, or how to deal with pets and how to deal with children, and including that question specifically. Thank you, Madam CEO.
Madam CIO, I just want to interject here. Dr. Arra, the revised public health unit website is absolutely amazing. Very, very informative, and it could not have come at a better time.
Thank you.
Madam CAO, please.
Thank you. And thank you, Doctor, for that answer. Just moving along. This question is for MP Ruff. Some of our smaller villages and hamlets have closed their stores that are also their post offices. This is an inconvenience for many and forcing us to go to larger towns. How do we support postal kiosks in our smaller communities?
So great question. Actually, it's a question that is best answered by about 3 or 4 of us on this on the panel here tonight, because obviously Canada Post is a federal level issue. I know, so they are working for the most part in the Canada Post locations. However, as identified in the question, when they're getting closed because they're attached to a store, well, that's either decided based on, the provincial's decisions on what's essential and non-essential, and even in some cases with the municipal level. I know Canada Post has set in some protocols and policies for those stores that are open, or those post offices or postal locations that are open, to specifically help the most vulnerable, or those more at risk, i.e. our seniors and those that have greater access troubles. That the first hour of the day, is my understanding, is open. So what I recommend, if there's specific locations, especially here, if this is a question coming into West Grey, is let myself know, let Minister Walker know. We can talk to Dr. Arra as well, Warden McQueen, if he needs to weigh in, so that we can work together and try to identify that and come up with a suitable protocol that makes sure that essential service is getting delivered, i.e. the mail, because it is being obviously overwhelmed, because a lot more people are capitalizing on the mail when we're all sort of hunkered down. I'm sure some other people would like to weigh in on that.
Is there anyone else that would like to contribute to this answer? Certainly it was the solution-based answer. I'm not seeing anyone at this point. So, Madam CIO, please continue.
Thank you. Thank you, Madam Mayor. Our next question, please. This question is for MPP Walker. How will the Ministry of Agriculture, Food and Rural Affairs address the loss of grants to community groups who have had to cancel meetings and fairs?
Thank you very much, Madam CEO. In all of these cases, not just our local fairs and those type of things, but I can assure you 3 things are going on simultaneously as we speak. Minister of Finance has requested all of us to go out and hold virtually town halls with our chambers, our business improvement associations, with businesses to understand really what the impacts are going to be, what's happening. In regard to a lot of our tourism facilities, our programs, our events that are out there, again, Minister McLeod is doing those across the province with MPP Norm Miller, and certainly the Minister of Agriculture, Food and Rural Affairs is doing the same thing. So we're reaching out as we speak to understand just what this really is. We're getting, certainly Alex's office and my office are getting all kinds of calls. Should we cancel? How long? When do we know? Again, we can't make those determinations until we follow the medical science. But I can assure you that what we're trying to do is work with all those groups and agencies. We know, having lived here all of our lives, how critical and important these events are, not just to the economy, but to the social and mental fabric of the spirit of community we have. So we certainly are engaged with that. I'm the guy who typically on almost every one of these that we do those says we have to get everybody to turn away thinking there is just going to be a check showing up for absolutely everything out there, because frankly, every dollar of support is being borrowed. So you or when I saw Alex's 6-year-old daughter asking for the ice cream, which by the way, she can probably get from the warden from Chapman's, we need to ensure that we're trying to do things as obviously as responsibly as we can, but there's other things we can do with those. How do we ensure that we get the things like permitting and all of that thing done quicker so that we can move them through, so that we can give them some hope? And there's different administrative things that we can also help with. So all I would suggest to everyone, you are truly valued. I go to as many of these, Alex does, Paul does, everybody is out as much. We love these things. We want them to be back as quickly as we can. We don't want to see them falter, but we again have to put the safety first and do that as our first step, and then say, how do we address, what can we do? Probably, frankly, most of these events are run because of the generous sponsorship of a lot of our local businesses. So I'm going to put a plug in right now that's a more proactive. Everybody who used to go to those events, anybody who went to a fair, to any kind of public event that was a fundraiser, donate that money today, even as if you were going, if you have the ability, so that those businesses have, those sponsorships are there, and those groups that may have to take a year off this year can actually still have that working capital to move forward to next year. And again, I just can't say enough, support the businesses. We take for granted how many businesses do so many sponsorships, and yet they've suffered through all this as well.
Thank you very much, Minister. Our next question is for Warden McQueen. It's your last question of the evening. Small business is the heart of Grey County. Can you please tell us how you will support our downtown cores, and what is the plan for recovery?
So thank you very much for the question. And I was hoping to chime in the last question a little bit to help Mr. Walker out there. But I will say that through a coordinated community improvement plans will help deliver programs to help those small businesses that the county is working on. Certainly, the county has been doing a lot of polling and talking to the businesses to sort of get feedback on what's happening out there, and certainly working on a recovery plan to move forward. And there's going to be a number of, I think, webinars and things that will help get those businesses up and going again. The economic development team at Grey County is very much working very hard, along with the tourism part, and they haven't offered out. Some of the other counties are offering loans to businesses and stuff like that. From what I gathered, even from a conversation today, not all of them want loans. They want just to help to get them going again. And I think the big thing will be coming out of this, and this goes back to the question that Mr. Walker had with regards to community fairs. It's going to be upon us, whenever we come out of this, to support our local businesses and our community events, even more so than we've have in the past, because it's all about community that we are all about, and we just have to move forward in the sense of supporting each other. And you know, there's a lot of space between now and when this gets finally through, and certainly the county will work with these businesses and do what we can collectively, and certainly get them back up and running again. And you know, it's a huge hit to those businesses with regards to feeding families and doing that. And it just, unfortunately, we can't move forward until we get through this, and from the direction of Dr. Arra and the medical health, in the sense of how we work to that. But I will say that we got to come out and support each other and support those businesses once we come out of this, and continue on moving forward to the day that we can get back to regular business, for sure. And maybe there will be also, I think, from federal and provincial government, there may be some small assistance there, and I'll maybe leave that up to, you know, Minister Walker, and maybe Alec, a representative from the federal side. They may have some comments there too. I don't know, but I would say is the common theme throughout this. We're all going to work together to do what we can in our power to certainly, you know, help everybody as best we can.
Thank you, Warden. And before we carry on, I would like to let you know that your video seems to be pointing to either the ceiling or the floor. Your audio came through loud and clear, but we didn't get to see your answer. So I don't know if you need to adjust your screen. Madam Mayor, if I may offer up the question to our other members of the panel that may wish to elaborate as suggested.
Absolutely. This is the heart of a
Thank you.
roundtable, so certainly. Who would like to contribute to this answer?
I see Dr. Arra's hand. Perhaps we'll start there.
Wonderful.
So in emergency, the main task is to save lives. This type of emergency is a longitudinal emergency, and when you look at the determinant of health as defined by many organizations, including most importantly to me, the Public Health Agency of Canada, there are 13 determinant of health. Number one, and is the most important, is income. The income determines how much health any one of us has. And our local economy really depends, like the question said, on small business. So from public health point of view, it is important as soon as we can release restrictions to get local economy and local business going forward. The decision, again, is multifactorial, and different stakeholders around the table will participate to it. It is definitely on our radar as soon as there is control of the outbreak and direction from the ministry from the province to release these restrictions. It is definitely a factor to look at which type of business based on risk of transmission and based on how much return is going to come from the business. And it's going to be first business to open, and there's going to be a last type of business to open. And that's, not from public health point of view, it's not up to the like or dislike of the MOH. It's rather based on the data. And I know around the table, there are many people who would be able to evaluate the priority of these businesses from economic point of view. And when you have a decision based on evidence-based, it is always the right decision with the information at hand. Thank you, Madam CEO.
Thank you, Dr. Arra. And I see our MPP would also like to add to this dialogue. Please go ahead.
Thank you very much, CEO Laura. I just want to echo kind of what Dr. Arra is saying. The best thing we can be doing, even those businesses that aren't able to be open yet, is to be thinking, to be preparing, and to be ready to roll. The best thing we can do is get all of those businesses open as quickly as possible. Everyone who has a job is helping their own health and their community health. So the more we can be proactive, the more we can be planning, the more we can learn. I think there's a lot of businesses that have actually figured out new ways to do business that are actually going to be more economical maybe than they were in their old version. So we can do some of those things. And as I shared earlier, we are all across the province being requested by the Minister of Finance to go out and do roundtables and group functions like this to understand what the real needs are. And what I've really found in the first couple that some of my colleagues and I have done, it's not always about money. It's not always looking for a handout. It's saying, how do I be as efficient? How do I cut some of that administration? How can I and Alex go back to our respective parliaments and municipal, frankly, to be able to cut some of that administrative work that's there, that consumes time, that slows down being able to get out and actually serve a customer. And there are things that are already in place, frankly, like deferral of taxes, the forgiveness of some of the programs that are out there, or at least a deferral to lighten the load. I can share with you at the provincial level, again, in my Ministry of Energy, we are looking again at those Class B consumers of energy that we were already working on that beforehand. It's a big thing to change, but we were looking at that from an energy perspective to make sure we're as competitive as possible. So there's lots of good things happening, both in our small town, downtown cores, that company on the back 40 who actually now, once we get them internet with a not so swift program, they'll be able to compete equally as we go. But it's really harnessing the collective of going through this hardship and this challenge and embracing the innovation and how we can all work collaboratively to get that economy humming. And I can tell you right from the Premier on down, everybody around our cabinet table wants to do it as quickly, but I have to say it, as safely and as pronounced as we can.
Thank you. And I would like to add that, a lot of good things are happening right now, and it's very evident that many of our businesses have actually reinvented the way that they're providing their service and their service delivery. So that absolutely is encouraging. And when we're at a point where all businesses can be opened, I think we'll be in very good stead to have that happen. And I would absolutely encourage our residents to shop local, of course. Madam CAO, please.
Thank you, and thank you very much. I'd like to move on to our final question for, one moment, I just want to make sure I haven't missed anyone that would like to add to that. Okay, great. We'll move on to our final question for Dr. Arra this evening. What steps are we taking to prepare for a second wave? When would that second wave happen?
So the second part of the question is probably more straightforward. We don't know when the second wave might happen, and nobody knows. There is a lack of knowledge, and there is deep lack of knowledge. And I know I don't know, and I know other people don't know. Any simulation or any prediction based on the data we have is robust for a number of weeks. And we know we have flattened the first curve really well, the first wave. And that by definition puts a possibility for a second wave, which would be, in our case, the first one, because the first one really didn't arrive as strong at all as we anticipated to be. These prediction models are based on assumption, rightly so. That's the way modeling takes place. We have to have assumptions, and they're usually robust assumptions. But any prediction that's past 3-4 weeks usually lose precision. So I would know that in the coming 3-4 weeks, we have control over it, and we're gonna start releasing. And the plan to release in stages usually allows us to have control over the outbreak. And we might never see a second wave. We might see sporadic outbreaks in small numbers. And again, if we have control, and I see no reason not to have control over it, we might never see a second wave. Again, the first statement, lack of knowledge and deep lack of knowledge, it just comes from the medical training that many people say, you know, the physician might know, I don't know. And in this case, nobody knows. And that's the second question. The first one, what steps are being taken? Everything we have prepared for the first wave has been in place and has been refined. The planning for reopening is the major second step to have control over the outbreak. The engagement from the public, being aware, being concerned. This comes from many factors. One of them, the good messaging and the timely messaging. Just if you would picture with me, if we implemented all the measures of social distancing in January, we would have guaranteed nothing's going to happen. But it is guaranteed also in 3 months, people will be message fatigued. They're not going to respond with the recommendation. So what's going forward is always to reassess and gauge the behavior of the outbreak, the virus, and at the same time get as much information as we can from the public where the public concern is, and provide timely messaging to mitigate any potential risk that's coming forward. And again, this is an umbrella answer. There are many detailed work happening in the healthcare system and public health, in local municipal systems, and there is communication with all partners around the table. So this is, again, the same work that's been done, and we're building on it. We're collaborating. And if I'm going to go in specific concrete examples, what projects are going to be done, I probably will take 2 hours. I wouldn't even do it justice.
Thank you very much for the answer, Dr. Arra. Madam Mayor, before we go to the final question, which is actually for you, I would like to share just one comment that came through when we were talking about supporting local. And today is Giving Tuesday, so it's a great time to donate to some of those organizations that are, as we had talked about, concerned about their grants. So that was just a comment from one of our visitors tonight. And our final question, Yes, thank you. Our final question before we go to your wrap up is for you, Madam Mayor, and it's on the screen. I have a question about consistency when it comes to managing essential and non-essential businesses. How is enforcement being handled?
Oh, very good. Well, in terms of enforcement, our West Grey Police Service are responding as required. And what I would encourage our residents to do is to call the administrative office during regular office hours, and our staff will ensure that the information is transferred over to our West Grey Police Service and make sure that connection for the inquiry is made. That's a very quick answer, but it's a very quick process that we can manage.
Thank you very much.
You're welcome.
That concludes our question period. So Madam Mayor, I'll turn it back to you for final comments and wrap up.
Well, Madam CEO, thank you very much for managing the question and response portion of our roundtable. Very well done. I appreciate it. So this has been an information-packed roundtable, and I know our citizens will have and have gained working knowledge of COVID-19 and how it's impacting our community as a resident, but also as a business owner. And I would very much like to extend a thank you to each of our guests for participating and providing the updates and responding to the questions. So it certainly was worthwhile to have this roundtable, and we appreciate your expertise. I just want to say, please stay safe, everyone, and remember the advice of our public health experts and our provincial government, and that is wash your hands frequently, practice social distancing, only venture out when required for errands and for groceries and medicine, and certainly please shop local. Take care, everyone, and thank you very much for joining our roundtable, and have a good evening.